we all know that exercise is very important, but it is so difficult to do it workout regularly and constantly and sustainably. How can we do that? I don't want to do it by myself. Oh, I have lots of things to do. I don't have money to buy a wearables. And wearables is always not very accurate. What can I do? Oh, well, how can we tie out to Let's Get Healthy county program or state program, or how about Let's Move? A lot of programs that the state government or federal government gave us, but it is very difficult to get this very effectively. And how can we bridge these two gaps? Now we have a solution for you. Workout Together is a fun, challenging, and rewarding program that you have to download right away. Let me show you. As I mentioned, there are so many programs that are so good. We have free aims for the Let's Get Healthy, better health, better care, and lower cost. But it's not very effective. And you can see, Michelle Obama has done a lot of work in Let's Move, celebrating for 5 years. But I believe that not that many people are very embracing this program. Why? We still see that a lot of problems in obesity. This is the distribution chart. Particularly this area, of course, need more help. And how do we know them? How do we help them? Here's the solution. Let's find a buddy. Let's find someone to work out together with you. Workout Together is an application for mobile for consumer, and also an app that put it onto the web for state and federal government. In the mobile side, then you don't need to have a wearable. You cannot say, I don't have money to buy, I don't have money to buy an iWatch. And every end of the day, you will have a winner. Whoever burned the highest calorie of the week, that we will give a prize for them. And whoever gets the highest most like of the week, you can also get a prize. So where's the money come from? We come from the ads. This app is totally free for you and me, but we will charge merchants to sell advertisement on this. For state government, why so important? We want people really move. And all this data can fit into the database, and from here we can see clearly the distribution of diabetes and COPD asthma. They are very different. So we have the goal, better health. So we get people more healthy because they have better productivity and they tailor to the disease conditions. What kind of program better to asthma? What kind of better programs are to diabetes? So these are the analysis we get it from the open source data. We're helping you to answer questions.
Hi, my name is Sac-Code-A-Thon. I'm going to talk about the health feed application. So we all know that there's a lot of valuable data out there, but the problem really is getting the data to the right patient. So for example, California Open Data Portal said there's a lot of data, but what we're trying to solve here is trying to get the right data to the right patient. So that's really what health feed is all about. So the health feed content widget is a smart content widget that can be attached to any health portal. So for example, in this particular case, it happens to be a patient portal under which we've attached it to. What it does is it sources some information about the particular patient's medical conditions and is now able to show some content that is very specific to that particular patient's health. So we've got two sources of data that we built into the health feed widget right now. One is coming from the California Open Data Portal sets. We've taken data from the independent medical review decisions, and so in this particular case I've seeded the content widget with somebody who has diabetes. So it shows a bunch of content from the medical reviews from the California Department of Health relating to diabetes related cases, and it also shows about other hospitalization rates relating to diabetes. A second source of information that it also has is content from external sources, such as patient education content sourced from top internet sites or content from the National Library of Medicine like Medline, PubMed, so on and so forth. So in this particular case, I'm going to click on one particular row of information here. And what it essentially shows is the review data relating to diabetes. So every day I log into this particular portal, then it shows me new information relating to my specific medical conditions. So what I could also do is I could click on this particular Did You Know widget, and it shows the hospitalization rates relating to my medical condition across various counties here in California. So the idea of this content widget is to essentially show information that is very specific to that particular patient's health and medical conditions. Any other questions?
So we are Clear Health. My name is Devin. We have Omar, Atta, and Islam. And we're focused on the problem of how do I find the best care at the best cost. So there's a trend towards increasing consumerization of healthcare. But the problem is that a lot of that data is still opaque to the average consumer. So it's really hard to find reliable data on cost and quality for your area. So for example, if you look at mortality rates across various conditions, we do find that there's obviously various mortality rates across all these conditions, but if we zoom a little deeper into AMI, for example, which is your standard heart attack, we find that the mortality rate actually differs a lot across regions as well. And this is a signal that different providers provide different levels of care at different levels of cost. And we built a tool to help consumers navigate that problem. This tool is called Clear Health. You want to refresh that page there?
Tell me it full screen if you reduce it.
Okay. So Clear Health provides a portal for finding the best data on a particular medical procedure. So let's go ahead and enter acute myocardial infarction and hit find the best care. And now we're going to choose our insurance. Hit let's go. And we get a map of, actually can we pause, and we're having some technical difficulties with the display.
Just hit the green button. Green button.
Green
left
button.
corner.
Try to make it
The problem is it's full screen. If you take it out of full screen, it'll be fine. Yep.
Okay, can you refresh the splash page? Sorry about it. Okay, yeah, so this is actually what our site looks like. That was so it actually is a very nicely designed site. So we just entered acute myocardial infarction. And as you can see, we have all the price data, rating data, and mortality rate that we pulled from your data sets. So if we drill down on price, this actually gets really interesting because we went to California ChargeMaster and we found the various prices for various procedures for this particular condition that the user has. And we can see a breakdown of those diagnostic costs. We pulled a rating from the patient advocacy report card, and we got the mortality rate from the data that you provided us. So we think there's a huge benefit to just combining all this data and making it easily accessible for the user. And the crazy thing here is we can actually go anywhere in California and perform this search and find how do hospitals differ across different areas. So here he's performing the search for Los Angeles, and we see similar price ratings and or different price ratings and quality ratings for these procedures. So this is the first time that we've ever really been able to combine cost data with quality data. So what our team did is we took all the heavy lifting out of that cost data, we went to the ChargeMaster, we looked at insurance plans, and then we combined it with the quality data that you provided us. So we think this combination is really powerful and has a huge potential for nationwide impact. So here we have the potential to empower millions of patients. On the payer side, we can optimize payer spending. On the policymaker side, we can actually drive cost containment policies. And if this goes nationwide, we have the opportunity to incentivize hospitals to compete both on quality and price. And we think that's a really powerful solution. Looking forward to your questions.
All right, thank you guys for being patient. My name is Merritt, and we are Rocket Department. So I'd like to share what we've built for the last 24 hours. So everyone in this room understands the power of information. That is why we are all here. We all think data is cool, everyone in this room. But how do we make this data cool for other people? And more importantly, how do we make it so that we can improve their lives with this health-related information. So we set out to create a method of displaying useful health-related information in a way that is very intuitive and engaging, and also really interactive. In the time we were given, we created GeoPulse, which is a hardware display controlled by a web app that pulls data dynamically from the California Health and Human Services data portal. And with that, we're able to display any set of health-related data that has location data attached to it. And more on that, I'm going to pass it over to Emma, who is our embedded systems engineer.
Hi, everybody. So there are 237 addressable LEDs in this display. So basically what we did is we went through the data sets, found those with geolocation, took that data, it goes to a web app, which Andy Axton wrote, and you can see the display on there. So this is how you can actually control what comes up on the LED display, is you select a different data set, there's an API hook. That data gets sent to the hardware via Raspberry Pi. The Raspberry Pi reads the JSON object, and you get different data sets. So you could expand this, make it bigger, more LEDs, more granularity for your data. This was our proof of concept in 24 hours, which was pretty exciting and harrowing to build. But so far we have 3 data sets that are incorporated. We have Wicket, we have the pancreatic death mortality rate, and
Sorry, my nav is hidden for selecting the resolution's different.
and I think the GI mortality rate. But I think the thing I like most about this is we can expand it as the data sets grow. Anything that's zip code, county, or lat long points can be loaded into this with a few API hooks into the open data portal. And I see this going to schools, going to the state fair, different places, people who aren't Googling and looking up health data, people who just see it and they're like, pretty lights, and then they learn something. Thank you.
And participating in them. So now let's get away from me, even though my narcissistic side loves talking about me. And get on to the actual problem. So my problem that I tried to find data about and encounter is infant mortality, which is, as it says right there, is the death of children under the age of 1. This is one of the most terrible problems, and sadly, it happens all over the world. In California, most races/ethnicities, because that's how they do statistics, the poverty rate seems stably around twice the percentage of infant mortality, except for Latino/Hispanic and Pacific Islanders/Hawaiians, which have high poverty and infant mortality, respectively, compared to vice versa. And then here, I'm just going to leave you with the statistics, the facts. So, how I'm using this data for the solution, but I'm going to use the data to create a proposal to the California Senate so that it can allow state-sponsored health care and allow more people who are technically suffering poverty to gain access to proper hospitals and through that decrease infant mortality. That's my last slide. So I presume you have questions? Or not?